Assalamualaikum warahmatullahi wabarakatuh. We are from group 17. Today we are going to talk about the contemporary issues, which is the treatment in Islam. So throughout this video, we're gonna get through three things, which is the rulings, the ethics, and the conclusion from our discussion. So actually, the medical treatment is already exists since the age of the Prophet, but nowadays our medical treatment is influenced by the Western style. This is because their way is more advanced and their technology is more efficient. Most of the hospitals or clinics or medical center nowadays practice this kind of method. So the issue is, can we as the Muslim use this method? So the answer is yes. Scholars say yes, but in order to practice this method, we must also obey the Sharia, and we must follow some rulings and ethics. So the rulings and ethics will be discussed after this.
So for the ruling part, where medical treatment or seeking a cure is allowed, because of the report of Abu Darda, may Allah be pleased with him, who said, the Messenger of Allah, Muhammad sallallahu alaihi wasallam, said Allah sent down the disease and the cure, and has met for every disease the cure. So treat sickness, but do not use anything haram. Report by Abu Dawud. So for the second hadith, the hadith of Usamah ibn Shurat, may Allah be pleased with him, who said, the Badwin said, O Messenger of Allah, should we not treat sickness? He said, treat sickness, for Allah has not created any disease except He also create the cure. So except for one disease, they said, O Messenger of Allah, what is this? He said, old age. Report by Al-Tirmidhi. And then the majority of scholars, Hanafi and Maliki, said that medical treatment is mubah, which is permitted. The Shafi'is and Al-Qadi, Ibn Akil and Ibn Al-Jawzi said that is it mustahab, which is recommended. It is because the hadith, Allah has sent down the disease and the cure, and has met for every disease the cure. So treat sickness, but do not use anything haram. And other hadith which is contain instruction to seek cures, they said the fact that the Prophet, peace and blessing of Allah upon him, used cupping and other kinds of treatment indicates that medical treatment is permitted. For the Shafi'is, treatment is mustahab when there is no certainty that it will be beneficial. But when treatment is certain to be beneficial, such as putting a dressing on a wound, then it is wajib or obligatory. An example would be blood transfusion in certain cases. That's all.
Assalamualaikum warahmatullahi wabarakatuh. So like most people would say that seeking treatment is against the concept of tawakal, but no. Like referring to what Jazlan has said concerning the Sahih hadith that speaks about medical treatment, Ibn Al-Qayyim said, by just warding off hunger, thirst, heat and cold does not contradict towards the concept of tawakal. By not treating yourself with a proper treatment, is actually the opposite of the concept of tawakal. It goes against the true command and wisdom of Allah. We, as a Muslim, must use the concept of tawakal, yes, but that does not mean after tawakal, we do not have to do anything and just have to wait for like some miracles to come falling from the sky. No, that is not the Islamic way. Instead, we must ikhtiar to find solution towards all our problem after tawakal to Allah. That is the concept of tawakal. In brief, seeking a proper treatment or cure from a disease or illness is obligatory towards all Muslims. The person must accompany the treatment or cure with a lot of dua from Allah, asking Him for cure towards the persons, because that is what the concept of tawakal is. As mentioned in the Quran, kun fayakun. Allah said be and it is. So if Allah said like that person will be cured, so the person is cured. And the patient also should not forget to put all his trust in Allah, as Allah is the greatest healer, and no man can even compete against that. So that's it. Thank you.
So next is the ethics. Some of the rules of medical ethics include, the first one is respect for the autonomy, and second, the beneficence. People are autonomous in the decision-making process if they are able to understand and make intelligent decisions for themselves, which are intentional and voluntary. The right of patient self-determination accepted by the state is based on this principle. The second principle is that of beneficence, which oblige persons to benefit and help others. These principles requires positive action to prevent what is bad or harmful, to remove what is bad or harmful, and to do or promote what is good and beneficial. The Islamic principle of forbidding what is wrong and joining what is good illustrates this. The knowledge of medical technology obliges Muslim physicians to offer what medical justice requires. Medical justice by itself is a principle of fair distribution of benefits and burdens. Justice requires that persons receive that which they deserve and to which they are entitled. These principles involve decision to allocate scarce resources. The actual implementation of this principle remains somewhat controversial. Physicians' response to individual justice differs at times with social justice. Another rule is non-maleficence. This principle obliges persons to refrain from harming others, including refraining from killing them or treating them cruelly. It is one of the non-intervention. That's it for the ethics.
So the last one, conclusion part. The Islam medical treatment is a form of medical system that has been conceptualized and worked by Muslims from the beginning Islamic age until now. It is based on the principles and the doctrine of Islam itself. And then the Islam treatment or medicines is a Muslim concept to handle health problem that parallel with the view that God, man, nature and society are interconnected with each other in a harmonious way. So the Sharia is the one of the main points that can be a base for the Islamic medical treatment. That's all from us. Thank you.